Perfect. Well, I think that we can go ahead and get started. I'm sure some others will pop on. Looks like right now everyone is muted, which is beautiful. I will continue to mute anyone who hops on. But then if we have any questions, just feel free to unmute, and Vivian is happy to answer any questions that you have. So again, this is part 3 of our Understanding Dementia series presented by Vivian Green Corner for the Right at Home of Essex County and Right at Home of Union and Morris counties. So Vivian, I'll go ahead and turn it over to you.
Okay, I'm glad to be back. And as Megan said, this is our third part, our final part of understanding dementia. And if a picture says 1,000 words, this hand holding is what the final stage is about. Um, it says a lot. We're holding hands, we're guiding them. So, the purpose of our training today is understanding the changes in late stage, giving you some tips for your daily care tasks so you're more effective in that, and activities to engage. We continue to do activities. We're going to modify it and I'm going to give you a lot of different suggestions. So, in understanding late stage, there is severe memory loss. They might not recognize you, even if you've been taking care of them. They certainly won't recognize family members if they come periodically to visit. They might not know who they are. And that's very, very hard for families. So, I just want to suggest that when a family comes in, I'll use myself as an example, you're going to want to say, Mrs. Jones, it's Vivian, your daughter. She's here to visit with you. It goes a long way for families, and keep using that family member's name in conversation. Communications become very difficult. Um, Speech might be limited, or they might not be speaking at all anymore and mumbling. And on the other side of it, they don't necessarily understand your communication. It's not a hearing problem. Their brain just doesn't understand anymore putting your words together, what it means. Incontinence is often an issue. There's loss of bladder and bowel control, difficulty chewing and swallowing. There's a risk of choking and maybe aspiration. We're going to be dealing with this. And understanding that there can be emotional distress with being more out of it, not understanding. There's more likelihood that individuals can become more anxious, more agitated, or some can become emotionally withdrawn, sort of blank. It can vary, and it can vary from person to person. So I want to jump in right now. These are what I think are guiding principles that need to be done every single time you have an interaction with somebody who's in late stage. It might not seem necessary, believe me, it is. So the first thing that you want to do, what I call, is prepare yourself. Leave all your stress and distractions, frustrations at the door. Whenever you're interacting with somebody, even though you might not feel that way, you need to present with a smile and positive energy. The reason why is at late stage, the individual still can pick up the what I'll call the emotional temperature. Maybe something's wrong, but they won't be able to interpret it. So on your end, it might be something stressful, not major, but they will pick up stress and they might misinterpret it as if they are unsafe. So it's always, always important. Every time you have an interaction, when you enter that door, it's smiling and positive energy. You want to prepare them. You always, and it seems crazy, and it's not, every time you have an interaction, for instance, in the morning, you're going to walk in and say, "Hi, Mrs. Smith. It's Vivian. I hope you had a great night's sleep." Or in the afternoon, "Hi, Mrs. Smith. It's Vivian. I brought your lunch." How was your nap? Always use your name, use it all day long when you're having that interaction. It helps their brain. And they're not having to remember, what's your name? Who are you? You're telling them straight out. Your approach is always in front of them. So that means that when you enter into the room, if let's say you're putting clothes away, you're not going to start that conversation. All conversations that you have with an individual at late stage have to be right in front of them, making eye contact and eye contact at their level, which means if they are sitting, pull up a chair. If they are lying in bed, pull up a chair. You want to have that eye contact at their eye level, never higher than them or lower or in a different direction. Again, all of this is much too confusing for their brain. Our job is to make it easier for them. Even if they are not communicating, we are still talking and we're speaking very slowly because they process things at a slower pace than we do. "Hi, Mrs. Jones. It's Vivian. How nice to see you." Lots of pauses in that conversation. When you're not doing what I'm suggesting, there's more likelihood that they might get agitated because it's too much stimulation and it's too confusing. It's our job to keep it simple. When we're doing things, we want to always ask them to participate. If it's brushing their teeth, could they hold the toothbrush? If you're changing their clothes, could they help you? Could they hold the new shirt that you're about to put on? You want to keep them engaged. Don't manage, don't do for them, because the more they're engaged, it's going to be easier for them to comprehend what's going on. And of course, under engagement, never test them. Never say, "Oh, you remember who I am," or "You remember your daughter," or "You remember that you have to open your mouth to brush your teeth." We're never going to test them. And you know what? If they don't want to have their personal care done, they don't want to have their medication at that moment, take a break. There's certain things that are safety issues that you can't, but many of what we do, we can take a break and maybe ask them, it seems that we should be taking a break, or are you tired? Or you seem sad. That's the time where you want to have more physical contact with them, maybe stroking them, touching their face, smiling, 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 and taking a break. You want to validate if they seem a little disturbed, acknowledge, we're going to take a break now. And again, decide if that task needs to be done, completed at that moment, or if you can delay it. This final stage does require delaying the tasks, and it's fine. It's not as if you're not doing your job well. Doing your job well is really taking their lead, paying attention to their response to what you're doing. And everything is going to take a lot longer. So build that in to your day. These are the four primary areas of what you're going to be doing: the feeding, the hygiene, the clothing, and changing, transitioning them um, uh, from either their bed to a chair to another chair, or maybe they are bedbound and you're having to move them from side to side. Um, when feeding now, most likely at end stage, we're really talking about offering soft food, easy to swallow food, food that's in little pieces for them. Maybe thickening liquids might be useful. That's something to talk to the family and have them talk to the doctor about that. Sometimes they can't drink out of a glass anymore. Might be more successful in using a little syringe and putting it to their mouth. Um, in terms of feeding, I'm going to talk about this concept many times about warming up the brain. I like to suggest that if you're feeding with a spoon, that you just put it on their lips first, not in their mouth. Let them get a sense of what's happening, if they can smell it, if it reminds them. And at that point, you want to open your mouth to show them and then put the spoon in. A lot of the communication is showing rather than telling. So it works very well as you're feeding, whatever it is, if it's oatmeal, scrambled eggs, yogurt, ice cream, a little bit of cake that's soft, then put it right on their lip first and let them take it in their mouth. And that's a cue to the brain that feeding is going to happen. Um, in terms of hygiene, you're going to be involved with now all the bathing and the toileting, brushing of their teeth. You want to get one of those soft toothbrushes. Um, uh, and in terms of their skin care, they can help you. They can hold the washcloth. They can hold a piece of clothing. They can hold the toothbrush. They can hold the hairbrush. But you will be doing all of that hygiene for them. And in terms of clothing, we're going to change to everything being very soft, easy to change clothing, better that it's not over their head. If it's got buttons or snaps, that's easier. It's kind of scary and they're going to be more resistant. It's not involved with over the head. They got to raise their arms, going to put it over their head. Better if, like myself, you have some kind of shirt maybe with buttons, snaps, zippers. Um, and in terms of clothing, I want to just jump in that part of what goes on with this brain disease is that their body temperature is off. So when we feel hot, they might not feel as hot, or they could feel hotter than we're feeling. It's really up to us to pay attention to their clothing. And mostly you want to keep them in warm clothing, but don't overheat them. They're not going to be able to convey that they communicate that they're feeling cold or overheated. So, you know, layers in terms of maybe a blanket, a quilt, things that you can take on, off, an extra little throw blanket, a couple of them to have around is always helpful. And mobility is going to be on you. You need to know how to transition somebody, bend your knees. We don't want your back to go out. So it's very important to know how to transfer somebody effectively by bending your knees. You're going to tell them, we're going to stand up now. Oh, can I give you a hug? Let's hug each other, because you're going to want to get your arms around them, behind them. And I always love saying, let's hug. And you might want to hug for a few minutes before you're transitioning. All of this is very important. Have that connection, build that trust. So here are some tips, and let's run through them. Again, for their brain, it's it's really important not just for you to have a routine and offering care, but what they are used to. So, whatever your routine is your routine. Um, do they have breakfast in bed? Do they get up and toilet? Do you change their incontinence product first? Then are they having their medication? Whatever the routine is, try to stick to that routine in offering care. And the same is when you're doing personal care. Do it the same way all the time. And have your equipment and your supplies right there, right in front of you on the counter, on the bed, so you're not having to leave the room and collect things. You always want to keep that room quiet and calm. You can put music on, but it should be enjoy your music, but they like that it's quiet and calm. When you're communicating, we already talked about that. It's calm, it's reassuring. I'm going to put something nice on for you to wear. Oh, I'm going to change so that you're comfortable. I bet you're hungry now. I've got something delicious for you that you love to eat. It's always with a sense of reassurance and positivity and calm. We talked about the eye contact. Before you do any care, it's always useful to start with a touch. Even if you're, for instance, going to change your top, give a massage, touch that arm. Anything that you're going to do, brush their teeth, give a gentle touch before you do that. Gentle touch, as I said from my opening slide, that hand holding, we're going to be doing that a lot of touching, a lot of appropriate touching, a lot of hand holding. I find it's very, very useful, men and women, to give them something cuddly to hold. Amazon has these great big cuddly animals that are, it doesn't matter what kind of animal it is. It's about 12 inches high, really cuddly. And I find that in anything that you're doing to have that cuddly animal for them to hold brings comfort. So if you're doing any personal care, even feeding, anything that you find that they get a little agitated, just bring that in. It's like a toddler that had something comfortable that they like to have in their bed with them. And that animal can be, put on their side of their head as kind of an extra soft pillow. I really like cuddly, something cuddly to hold. As I mentioned, play music if you would like. It's always music that's familiar to them. That's music from 40s, 50s, 60s, but it's familiar to them. Not your music necessarily, but what they enjoy. And you can always find that out from their family members. We talked about taking a pause while offering care. Sit down, have a chat, um, give a gentle touch. Um, that kind of care can be very startling. You can anticipate what the steps are. Their brain doesn't allow them to anticipate anymore. That's why you need to take pauses. And of course, no correcting, no arguing along the way. When we correct and when we argue, not only are the words wrong, but our tone of voice changes and it's alarming to them. This is really important, especially in the late stage, in terms of monitoring signs of pain. Um, the individual who has pain at late stage will not communicate to you where they're feeling pain. It's really for you to look at what's nonverbal. Maybe they're grimacing or they seem more restless. They're not going to be able to say, I have a headache or I feel um, I have a UTI or I need to move my bowels. It's not going to happen. And if they're grimacing, um, it's really up to you to figure out, are they too hot? Are they thirsty? And you're going to start slowly. Now, you could possibly touch areas of their body and see if they grimace. But that's really for you. And again, you're going to be looking for those nonverbal signs of pain. Um, and that applies to looking out for signs of infection, whether it's a UTI or possible pneumonia or skin issues. You're going to look to see if their skin color has changed, if it feels different, cold or hot to the touch, if the urine smells, if they're more reluctant to eat, those are signs that something is going on. Is it pain or is it an infection? And if they do, we want to ensure safe feeding. And one of the ways to do that would be to ask the family to consult a speech therapist. Speech therapists help with feeding, not just verbalizing and talking. Um, so they can give you some great tips about safe feeding for your particular individual. As I said, I can give you general suggestions, but that speech therapist might be a consultant to bring in. And of course, you want to check for constipation if they haven't moved their bowels, what you need to do, whether it's hydrating more or they need to be taking something for less.
1177 from the Dental.
I mentioned about engaging. I want to say something before we talk about engaging activities because I think it's important to address. Your job is so much about making them feel safe and comfortable. Um, all of what you do, all of what you say is always about making them feel safe and reassured. We talked about the smiling and the touch, but you're it for their emotional support. You're the one that's going to make them feel, I'll do that. I'll change my clothes because I trust you and I can rely on you. So, all of that gentle touch and the hand holding and the familiar music is a communication that I'm here for you and you can lean on me. Um, Now, some of it also might be prayer, knowing their culture and their religion. There might be some rituals, there might be prayers. Nobody's dying, but a visit from the clergy might be something that they welcome, and that's something again to talk to family about. It's not. It's for the purpose of something that makes them feel good. Um, and you're always going to want to talk to them, even if they're not responding. You continue to talk, and you can talk about whatever. It's a beautiful day today, or it was raining this morning, but it's not raining now. we really don't know what they're understanding. So keeping it quiet is really not the way to go. Keep talking, keep reassuring, and you might want to talk about the past. You know, I heard, when you grew up in Brooklyn or when you were from the South, and talk about the foods, find out their history, and you can reminisce with them. Um, that storytelling kind of reminiscing goes a long way. So let's move on to that's kind of the baseline, but I want to move on to um, engaging an individual at late stage can be very challenging because they're limited with their communication and their mobility um, and their cognitive ability. However, sensory based and emotionally soothing activities will give them that comfort and that connection with you and stimulation. We still want to provide stimulation. Um, so here are some safe and meaningful activities tailored to this particular stage. When we're talking about sensory, we're talking about our senses, touch. So again, I mentioned the hand massage is a sensory activity. Brushing their hair, having a warm washcloth on their face is a sensory activity. Some people like the fidget blankets. They have zippers and buttons and different fabrics, something that they can touch that feels familiar to them. And as I mentioned, holding a stuffed animal, blankets, that's all things that they can touch that's comfortable. Sight, what they see. If you have an iPad and you can put on maybe an aquarium or fish tanks, seeing the fish go by um, is a wonderful sensory activity. Looking at photo albums is another activity, and it doesn't matter. Don't say, "Oh, this is your daughter." You're just looking at pictures, and I love nature pictures that include birds or trees or the weather. Again, that can be on your tablet, or it can be in a book. That's the sight. And the sound part, as I mentioned, is you want to listen to some nice calming music. Um, uh, uh, it can be hymns, but that songs have to be familiar from their youth and their cultural background. And some people like poems that you're reading to them. They're hearing it. It's the sound. Um, the other sensory activity is in terms of their smell. A lot of people like the aromatherapy, the lavender, the vanilla, the citrus, scented towels where you can put a little lavender on the towel before you're going to do that personal care. They're smelling it. It smells nice to them, um, and taste. Um, you know, give them the ice cream if they want the ice cream. Give them those soft treats that they love. I mean, why not? Um, if they have a lip balm, that's a vanilla or berry, that they can smell it. Again, they can taste it. Um, some people like those herbal teas or flavored waters. Um, all of this is the sensory activities. Um, and you heard it. I'm happy to send you a list of these for for you. So again, it could be shaping Play-Doh, listening to music, the familiar songs and hymns, the cuddling of the animal, and for some people, holding a doll. Holding a baby doll can be very comforting, especially to women. So now interactive activities. These are not sensory. We're moving on to interactive. And this is, again, the holding of hands, turning pages together. You can turn a page, they can turn a page, you can turn pages together, looking at family albums, softly petting a companion animal or a robotic pet. You know about robotic pets? They're fabulous. Another Amazon purchase. If somebody has had a dog or a cat, and when they grew up or raised their kids, bring it back with a robotic pet. Holding religious items are very comforting and meaningful. And again, singing or reciting familiar songs together, nursery rhymes, religious prayers. Music is huge, and music should be there a lot during the day. You can pull it up on your iPhone, on your pad, on your Alexa. Music is very deep in the brain, and it brings comfort. We want to lower any agitation, but have a comforting day, and singing together, we could do that. And if your person is able to go outdoors, just sitting in the garden is helpful, or your park or on a patio, feeling the breeze, feeling the sun on their face. It feels good. I love it if it's possible to go outside in a park with your children's voices. They respond well. You don't want it so loud, but if you're sitting at a distance and they can see the children at play, go to a playground. Let them see it. It's delightful. Bring flowers, or in the fall, leaves that they can smell, that they can touch. Listening to birds, wind chimes if you have it. And there's nothing small about watching clouds go by. So I wanted to mention about Amazon. There's a lot that you can get on Amazon. And there's another site called the Alzheimer's Store. They have a lot of sensory activities for you, some creative ideas at the Alzheimer's Store. I know that people are sleeping more. Some people at late stage can be sleeping 15 hours a day. But that doesn't mean you don't want to, not have the music going, even if some aren't sleeping deeply, but their eyes are closed. So you want to do the sensory, the touch, the sound, the smell, and a lot of those resources, again, can be purchased at the Amazon or Alzheimer's Store. So I intentionally wanted to kind of shorten this because I wanted to make myself available for any conversations that we can have, any questions that you might have, and also share things that have worked for you on your end, because you're doing the direct care. So can we open up this now for any comments that people have? Megan or Jackie, do you see any comments or questions?
No, not yet. Just so everyone knows, if you do have a question for Vivian, you would have to unmute yourself to ask. So if anyone has any questions, this would be the time to unmute and hop in.
I want to, just as we're waiting to see if there are any questions, mention that I have found in my work that sometimes you can be brought in on an earlier stage and have a really great relationship with that person, but not know what to do with late stage. So we want to make sure, and that's why we're talking about this today, that you can be there throughout that Alzheimer's or dementia journey to the end. It can be very rewarding and pleasant for you because you are there to provide that comfort and compassionate care to them.
Okay, Vivian, I have a question. My name is Patrick.
Hi, Patrick.
Yeah, my question is, do you use the same principle for combative dementia patients or residents?
First of all, Patrick, we want to find out why the person is being combative. I am of the belief that there's always a trigger that makes them, it's like a fight or flight. They don't know what's going on, Patrick, so they're going to themselves by being combative. So the principles that I discussed are very important. You want to talk to them about what you are doing, and you want to engage them, Patrick. For instance, if they're combative because you want them to stand and they don't want to stand. There's a lot of conversation, a lot of why you are doing what you're doing by putting your arms around them. You're asking them, could you look down at your feet and make sure that they're nice and solid on the ground? And then we're going to stand up together. So one of the areas, in addition, what I'm saying to telling them and cueing what's about to happen, is asking them to actively look at what you are doing so they're not taken by surprise. Somebody, as an example, can be combative, Patrick, when you are taking them to the toilet and you're pulling their pants down. Well, they didn't expect that to happen, so they're going to fight you. You need to tell them we're going to the toilet. You know, this is a great time before you eat. We're going to stand in front of the toilet. Great, great. Could you help me? Could you look down at your pants and put your hands there? And together, we're going to push your pants down. Lots of praise, lots of conversation, and it can be useful to kind of lower the flame on somebody being combative if you let them know what it is that you're doing and ask them to look in that direction. Hope that answered your question.
Yeah, very, very well, very well. In essence, the communication matters most.
Say it again, Patrick. What was your question?
No, I said no, no, no. I'm complimenting what you said, and in essence, in totality, what matters most is the communication.
we have to remember
It's
that we're anticipating it, but everything we're doing, even if we've done it over and over again, Patrick, it's that moment that they're in and they're being taken by surprise. They didn't expect this to happen. They don't even know why it's happening, but it's happening. So that's why we need to step in with much more communication and involvement, and patience, doing it slowly, step by step, taking a pause. Um, and as I said, you want to, um, my first couple of slides, you want to validate. You seem to be upset right now. Let's just take a break. Let's just take a break. You don't have to do this right now. You want to validate. You want to agree with where they're at. And you never want to say, don't get agitated, or there's no reason to be agitated. They're agitated. They're combative. And they're combative, I believe, Patrick, for a reason. Scary. They're scared.
Vivian, I see a hand up from Chioma.
Hi, Chioma.
Hi, Vivian. Thank you so much for this wonderful lesson. Thank you. How are you doing today?
I'm good.
Okay. So I just want to ask now, not directly on the client. What if in a situation where you meet a client whose family is quite difficult to deal with? Like, sometimes you kind of have your own strategy for things that work for like a dementia person, and you try to apply those things, but then on the other hand, the family doesn't feel that that's what should be happening. They want to tell you what to do and what they feel is right for their person. So in that situation, like, what do you do? Because I've been in that situation before and it was really tough.
You are not alone. I think all
Yeah.
of us been met many times.
Yeah.
One of it is that it's so upsetting to see the change in their family member.
Okay.
And they're coming from that place of being upset or wanting to deny it.
Yes.
And it makes them, when they tell you what to do and how to do it, it's almost like they're back in control again. But I believe it's in response to feeling how
Yeah.
sad it is. And their parent was never like that, or their spouse was never. It's hard.
Yeah.
So I believe that there are two things that, you know, it's to acknowledge that, yeah, there is a change. Um, and your mother's no longer able to do this because usually they want you to do something which is very unreasonable,
Yeah.
that their parent can't do or their family member can't do anymore. So it's hard, I would say, I would imagine it's hard to see that they can't do this anymore. And having, mom do something that she can't is going to agitate her. That's why I'm doing it this way,
Okay.
because I really don't want her to be agitated. And then you're going to want to throw something in, when she's able to do, and give an example, then she does that. It's not everything.
Yeah.
But in this case, this is really what's best for her because we want to keep and use the word we want to keep her feeling comfortable and not stressed. Um,
Okay.
and you might throw in like it's a tough brain disease, in other words, not personal. Talk about the disease, not the person.
Okay. Thank you.
We all, oh my goodness, I could tell you stories
Yeah.
about what they should be eating, what they should be doing, how they should be showered every day, how they should have their hair washed more. It goes on and on and on. And it's not, the message is that you're being negligent. That's the message, you're not doing your job. And that's where you need to start with what I said, which is, it's this brain disease is tough about what your mom, can and can't do well now. And, what I want to do is keep her comfortable. So does that make sense, what I was suggesting?
Sure. Thank you.
Those are great questions. I actually see someone named Marius has a question here in the chat. They just said, "Good day, Vivian. My name is Marius. Can an early stage dementia patient sometimes hear sounds or noises that may not exist?"
If they have Lewy body, they're hearing sounds and people that do not exist. Lewy body is one of the dementias. And there's a Lewy body protein in the brain which creates this. And that individual can see things, and they're very real. Mostly they tend to be children or animals that they see. Or it can go beyond that, it's they see it and then there's a noise that's a auditory hallucination. When that occurs, the response on your part is not to deny it, but to have a conversation about what is it that you see, and that you are seeing it, and I know it's real to you, but we are safe. And if you don't feel safe, let me know. Um, sometimes you can redirect them, and it kind of breaks the cycle. But sometimes if you do redirect them, they're going to take that, even in another room, that hallucination is going to go with them. But those hallucinations pass. They pass. Lewy body dementia. Any other hands that are up? I can't see it. Oh, Cynthia. Hi, Cynthia. Cynthia's muted. Hi, Cynthia.
Hi, Vivian. Um, Thanks for a very informative presentation. Um, Two things I took away mostly is at the beginning, where you mentioned when you enter the room, leave all your problems or everything outside the door. And I think that is so key because as caregivers, sometimes we have our own situations and you might just leave your home and then you get to work. And in dealing with the client like this, you have to prepare yourself emotionally. And your tone can set the pace for the day, because if you enter and you're in an angry state or something, you tend to take it out on, maybe not necessarily take it out on the client, but you're not that loving, patient, and kind. And as you said, they can pick up the emotions that something is wrong, and before you knew it, they're angry, and you're not getting them to cooperate and all that. So that's very important. And also being patient. With someone dealing with Alzheimer's, you have to have that kind of level of patience, for the whole process. because if you're not that kind of personality, it'll just make matters worse. And I thanks so much for all your tips.
Yeah, yeah. I have to tell you from my own experience, before I started my private practice and my trainings, I headed an adult day care program. I'm sure you all know what adult day care is. And the smiling that went on, I literally 6 months into the job, I felt that maybe there was something that I was wrong with my jaw. And I went to the dentist because I was using muscles all day long that I hadn't used because I was smiling all day long. And I thought maybe I have some problems with my jaw. And I realized really what was going on was that positive attitude that I had to have. Um, and the patience is enormous. I I I can also give you a personal story. The seeing my mom's aide, my mom had dementia, spend what normally would have taken 10 minutes to do her personal hygiene took 45 minutes. And I had such tremendous appreciation and respect for the aide taking all that time with such grace with my mother and treating her with such dignity. And I realized I couldn't do that. I was too stuck in my emotions, like, oh, I can't believe that she can't do this. And I think that's so important to communicate to families that, I'm doing this with the grace and dignity that they deserve. And I have the patience to do this, and I love what I do. I think that that's part of your work as not pushback, but real advocacy as to why you're doing what you're doing, why you want to do this job, is because you realize that that person deserves grace and dignity.
Yes, absolutely. You hit it right on the head. Thank you.
Yeah, yeah, yeah. Any last questions before we close? I just want to say thank you to all of you for what you are doing and that you came out to, you know, either learn or to realize that you are on the right track in what you're doing. I really I appreciate that you took the time to do this because you are on the front line. You are dealing with somebody who can't take care of themselves anymore. And what a blessing that you can help them. And so thank you. I appreciate your coming out today, and I hope I was helpful to you. So should we close
Thank
on?
you, Vivian.
Thank you very much. Yes, you were very helpful.
Okay.